They're getting crushed right now. They're getting what you call it, the cram down, right? DMEs are providing care management today to their patients, and they're just not getting paid for it. How would you as a DME like to make $170 per patient annually on top of what you already make?
John, welcome to the Co-Conspirator Track. It's really great to have you on. You know, we just announced our partnership together. And so why don't you tell the Co-Conspirator Club, just give us a little background on yourself and also One True Health.
Well, thank you, Caleb. It's an honor to be here, part of the Valere podcast. And we're so excited about the partnership that we're announcing. One True Health, this is my fourth digital health company that I founded. I've been in healthcare my entire career, all the way back to selling patient care systems on IBM 3090 mainframes back in the late 80s. Always been involved, though, in companies that focused on integration, data movement. So I really understand. This is why I'm really excited about Valere, is I understand the value you're providing in terms of automation for your DME and HME customers. So that's been my entire career is digital health. My first company that I started was back in January of 2002, helping to foster the emergency medical response to mass casualty situations after 9/11. Also got involved in humanitarian aid, logistics, and movement of comfort kits, cots, and blankets into disaster-affected areas, and the public health response associated with that, with organizations like World Vision and Samaritan's Purse and Save the Children. Really exciting times in that first company. Also been involved in revenue cycle management, long-term acute care, and now One True Health, which is a company that is focused on helping people that have chronic and acute conditions to better manage those conditions at home, where they spend 99% of their time.
Tell us about that aha moment. Like, what brought you to founding One True Health?
Sure. Well, so founded One True Health in January of 2020, so right before COVID. And the idea there at the time was, still exists today. You know, I live in Atlanta, Georgia. If I were to travel to Austin, Texas, and go to an ATM on the side of the street, I'd get a pretty accurate picture of my financial situation. If I get hit by a bus, that hospital, St. David's, is not going to have any information on me, my contraindications, any allergies, what's happened in my past. And why is that in today's digital age? We created a One True Health record, your single source of truth for all past encounter data, physiological monitoring data, Apple stealing my data right now off my wearable, and to put it into a format that an individual can understand. Most applications are written for healthcare practitioners, doctors, not for individuals. So we created that One True Health record, but COVID hit. In the middle of COVID, we saw the need for, people that were going into their homes that used to have, case managers that followed you home to help you with diabetes, hypertension, heart disease, sleep apnea. That just didn't exist anymore after COVID. Even today, we're 400,000 nurses shy of where we need to be in America. Clinical practices and hospitals aren't following you home. And 168 hours in a week, how much time are you spending in front of a doctor? 1 hour, maybe? And you see older adults especially walk out of a doctor's office with a stack of paper they don't read and they don't understand, and we wonder why they're not on their care plan instructions or medication instructions, and they go back to the emergency department. So it's chronic and acute disease management and chronic condition management is a big deal, especially, even today, especially for Medicare eligible seniors. And that's what we're here to help with an AI longevity platform and with 24/7 available clinical services.
So tell us about those services and just break down your care coordination effort. What does that look like?
Yeah, so it literally is following you home and making sure that we focus on health and wellness coaching. So, what can we do to come alongside and provide assistance through either artificial intelligence to get tasks orchestrated and completed, or just with the human touch side of being able to come alongside and provide coaching, even if it's a not so complex situation, but someone is dealing with hypertension or has come off of a heart disease transition, a congestive heart failure, or something in the hospital, and they're at home and they need a little help, right? To have a health coach to come alongside, provide those medication reminders, make sure that you're doing what you need to do. If you need to take your weight or if you need to walk a certain period of time today, there's someone there that's available to help you to do that. And that's Medicare and private insurance reimbursable attention that you would give to an individual to monitor the conditions that they have and to provide chronic care management coaching and health and wellness coaching. So that's really what we try to do. And again, we apply technology to it. We have a virtual care coordinator which is an AI tool, either voice or up to an avatar, that can interact with you. You know, it's something that's a delightful interaction that doesn't appear like anyone's banging on your head, but they're there. We're available 24/7 by 365, anytime available clinical services and health and wellness coaching.
When we talk about what a patient needs, that fragmentation is very real. The hospital doesn't talk to the HME provider. The HME provider doesn't talk to the payer. And when I say talk to, nothing's connected. Everything's super manual, right? And we do have great technology like you guys, but we kind of have this fragmentation going on. So what do you see as like a problem in that area with you guys? Are you guys, how are you guys working to solve that? And what does that look like?
Well, I'm going to answer your question a little bit differently because it's just right on my heart to do that. What you're addressing and speaking to is just the heart of why Valere has so much value in the HME world, is you have the ability of finding the data and integrating it and automating it and making the processes more efficient within a DME or an HME. That's what I saw from you guys to begin with. How do we provide value? How do we provide monetary value? How do we provide a stickier, more engaged patient that's valuable to you? How do we make sure that that patient comes back for resupplies and the attention that they need? So in the world of DME, I think we're kindred spirits. And that's what I saw with Valere, and that's why this partnership is going to be extremely effective for DMEs, is the way we work together and our shared values and goals for our customers.
Well, thank you, Shawn, for that amazing plug. We really appreciate that. And I hope you know that the feeling is mutual. And so, I think that's a good segue into, maybe sharing the origin story of the partnership a little bit. You kind of addressed it there, but how did our partnership come about? I know you and Dewey were connected, but can you share that story a little bit?
Yeah, it came from a friend that connected Dewey over to us. And again, just from one CEO to another, I like the way the guy thinks. He is so focused on taking care of the customer and providing that value, in not just in terms of your own core automation capabilities and efficiencies that your products provide, but thinking out of the box to say, we could build an ecosystem at Valere that finds other organizations that can add more value, and then we can work as a team together to just supercharge and address the current issues that DMEs face. They're getting crushed right now. They're getting what do you call it, the cram down, right? With payer negotiations and rate changes that occur on an annual basis. It was really hard going into 2026 when the new those negotiations took place. So you're getting crammed down. You need to find other sources of additional top line revenue. You need to find ways to improve your profitability within the DME itself. And then you got to make sure that your patient stays loyal, right? And that your core business is supported. And finally, wouldn't it be great if you had the data you needed, speaking of data and what Valere provides, that helps to provide the outcomes that prove that you're treating your patients better so you can get better rates and plans negotiated with payers. All these are critical issues, and it's what we're bringing together, and that's the origin story. And Dewey saw it from the beginning, and I think what we're going to announce for the industry, and we're going to show it MedTrade and the customers that are already achieving value in the DME world. From our side, we have DME customers, so we can prove everything we're going to talk to the industry about, and I'm really excited about that. But it takes a strong, dedicated partner and industry leader like Valere to really make it happen. And that's why we're excited about working with you.
Well, you mentioned that we definitely help with the flow of data, but really, I think you guys have a lot of data yourself that you can capture for the DME and help enrich their care and even the products that they can provide to their patients to make their transition to home smoother, their healing smoother, right? So can you talk a little bit about that and the data that y'all capture and how that can add a ton of value to a DME just on its own?
Sure. Well, let's just start with the really easy one. DMEs are providing care management today to their patients, and they're just not getting paid for it. That's the way the system works. A DME can't provide clinical services like a doctor's office can, right? So the idea was, how can we, if we're doing something that's more clinical or care management and orientation, how can we? And the key there is to add in a clinical practice. So our method and model takes a clinical practice that you can enroll into having chronic care management, physiological monitoring, transitional care management, reimbursable services from Medicare and private insurance. You can insert One True Health as an administrative services provider where we can perform all those services as a subcontractor to the practice. And then you can take the DME And the DME is part of the family. They come in and the time they spend is of subcontract to One True Health. That means that the time they spend with the patient, and I'm not talking about, I need your address to ship out your mask and tubing. I'm talking about if you're providing true care management, that time can be captured and then can be billed through the practice. So it becomes a three-way scenario here where now the time in care management actually becomes reimbursable, and that can be paid back to the DME for their time. So it starts there with that top line revenue. We can then, if you don't mind me going on, we can continue with improving profitability, right? Because when you are able to do that, you're able to then maximize the time that you're spending on attracting and retaining new referral partners, or doing other core parts of your business that can then improve your margins and your profitability. And then if we can provide a better patient experience and increase the loyalty to them in the home, that's an even step further of making sure that you achieve the revenue that normally would come into your organization. And then finally, if we can capture all the data, clinical care management data in the home, and One True Health can, and we share it back with you, and we share it back with your referral partners, then you not only have your referral partners that become more sticky and are more interested in working with you as a DME, but you also have the ability then of taking that data and going to the payers and saying, no, there's no cram down coming for me. I'm going to renegotiate because I can prove to you that the people you're paying for are getting better care. So it really, really opens up an entirely new, different world of profitability and value, because Valere has a customer that they're taking care of in the DME, understands the needs, we're coming along as a partner, and all of us are going to work together as a family to make sure your patients are better served, you're getting paid for the care management time you're doing, you're improving your profitability, and you're positioning yourself for better payer rate negotiation efforts. We also spend the time of our care navigators with the patient. We also have the 24/7 virtual care companion available for the patient. We take care of that patient. We issue time-based codes to the clinical practice. They get reimbursed, we charge, and then the DME is a subcontractor to us through a referral and support services agreement, and the DME gets paid. And we can show you a tremendous, even literally, how would you as a DME like to make $170 per patient annually on top of what you already make? I'll say it again, right? $170, right? So why is that important? Well, do the math as far as, if you've got 10,000 patients on what could actually, just in a calendar year of what that DME could make in terms of top line revenue. It could be literally transformative for their business.
Yeah. And it doesn't cost them any staff. And how essentially Valere would just set up an integration with you guys and their ERP or their source of ordering and truth and patient care. And just essentially we would just create an agreement, create a connection with them to you guys. You guys already have the partnership, with the clinicians, and that data is just automatically pushed, right? For that patient, that care is coordinated, that reimbursement happens, and then they get a check, right? I mean, at the end of the day. Okay.
They get a check every month. Every month. That's
amazing. So what's holding HMEs, DMEs now, I guess, from doing this? Is it mainly y'all's technology? Is it your ability to automate and streamline the care coordination through AI? Like what's kind of the silver bullet there as to, or really maybe the barrier for HMEs now? And then, how are you guys making this easy and seamless?
Well, I think the barrier is just, they've been told for so long, you can't. You can't. You can't make money on care management. You can't make additional top line revenue. No, you can't. You're a DME. You can't bill for that for clinical services. You can't. But what we found is the way the partnership works. So we're partnering with a clinical practice that's licensed and credentialed in all 50 states with 6,500 practitioners. So there's not a problem in the world with being able to take in patients, have qualifying visits, get them enrolled in a program. We even have enrollment specialists that do it turnkey. We do eligibility and benefits checks. We make sure everything is clear with respect to being able to serve these patients from the DMEs and be able to then generate revenue. And by the way, I say generating revenue, you're still making them healthier. You're making them happier. You're improving their longevity. And every time we talk to that patient, we remind them, your DME is the one that's providing this delightful service to you because they love you so much and care for you. And we can also support the DME with respect to renewals and resupplies and other things that are core to the business, because we're having communications with Susie on a regular basis, right? So all of that supports each other. But when the patient receives such delightful services that we improve their overall health and wellness, and the patient gets constantly told that's because this DME loves you so much.